Jamie Ralls. I was the audit manager on the audit. I'm going to start off with some troubling statistics that prompted us to do this audit. Oregon, like the rest of the nation, is in the midst of an opioid crisis. The issue impacts everyone, from infants to children to seniors. For infants, in 2016, almost 500 pregnancies in Oregon were complicated by maternal opioid use, and 280 infants were born with neonatal abstinence syndrome. From 2015 to 2017, 314 more children entered foster care due to a parent's drug abuse. Nationally, Oregon has the 6th highest percentage of teenagers with substance use disorder. And for seniors, Oregon has the highest rate in the nation of seniors hospitalized for opioid-related issues. The median cost for each of those hospitalizations is $13,000. Opioids can be helpful in addressing pain with appropriate medical oversight, but they're highly addictive. Dependence on prescription opioids can occur in less than a week, and taking a low-dose prescription of an opioid for more than 3 months raises the risk 15-fold. When it comes to providing access to treatment for those with substance use disorders, Oregon ranks last for adults and second to last for adolescents. Oregon has made progress in dispensing fewer opioid prescriptions over recent years, but our state still prescribes opioids at a rate of 13% higher than the national average, and the U.S. prescribes more than other comparable countries. The Oregon Health Authority reported approximately 7 million prescriptions for controlled substances were dispensed annually, with over half of those being for opioids. Our audit focused on an important tool that all 50 states use to help combat the opioid crisis. It's called the Prescription Drug Monitoring Program, or the PDMP. PDMPs maintain an electronic database of prescription information collected directly from pharmacies in an effort to provide physicians and pharmacists with critical information regarding a patient's prescription history. PDMPs also allow tracking of physicians' prescribing practices to help state authorities create informed guidelines and other efforts to improve addiction, prevention, and treatment. OHA oversees Oregon's PDMP. It was enacted in 2009 and started collecting prescription information in late 2011. The big takeaway from this audit is that Oregon laws prevent the use of a number of leading practices many other states have incorporated into their PDMP. Compared to other states, Oregon's PDMP collects less information, it's used less effectively, and it doesn't allow key players access to information. Our first key finding was that OHA could better use the PDMP data to analyze trends in prescribed drugs, including identifying patterns of possible opioid misuse and abuse. State laws prevent OHA from sharing information with key stakeholders, such as health licensing boards and law enforcement, on questionable activity. Our second key finding is that there is no requirement for prescribers to use the PDMP. Oregon is one of only 9 states that does not require prescribers or pharmacists to use the PDMP database before an opioid prescription is written or dispensed. Finally, we found that OHA is not collecting some prescription information that could be critical to preventing prescription drug abuse, including Schedule V drugs, method of payment, and diagnosis code. The PDMP data shows questionable activity that has been occurring in Oregon for years, but the state laws limit OHA's ability to investigate and mitigate such activity. By reviewing 3 years' worth of data from Oregon's PDMP, we found multiple instances of potential doctor shopping, dangerous drug combinations, and a growing trend of prescription stimulants used by many age groups. For potential doctor shoppers, we identified 148 people who received controlled substance prescriptions from 30 or more different prescribers and filled their prescriptions at 15 or more pharmacies within our 3-year time frame. The average person received controlled substances prescriptions from 2 different prescribers and filled their prescriptions at 2 different pharmacies. In contrast, the most egregious doctor shopper received opioid prescriptions from over 200 different prescribers and visited 75 different pharmacies for these prescriptions.